In this video, I'm going to talk about neurosis. And if you're suffering from depression or anxiety, and that's part or all of what's disabling you, I think you're going to find this helpful. It's a very broad topic, and I want to do it justice. So I'm going to divide my talk into several videos. This will be the first. I'm going to talk about what neurosis is, what it isn't, the different types of neurosis, how it's treated, and how it can cause disability. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, currently, neurosis is considered an archaic, out-of-date term. And since I myself am archaic and out-of-date, I like to use the term. To understand about neurosis, it's critical to go back to Sigmund Freud, who was a neurologist practicing in Austria and lived from 1856 to 1939. Sigmund Freud invented the modern specialty of psychiatry and coined the term neurosis to describe some of the patients that he saw. Today, it's fashionable to treat Freud as an idiot, and people only talk about what he got wrong and take for granted what he got right. And if you're one of the folks who thinks that Freud was an idiot, I suggest that you develop your own medical specialty single-handed that lasts for at least 120 years and see how far you get. Now, Freud was a neurologist, a doctor who specialized in diseases of the brain and the nervous system. He treated and diagnosed physical diseases. At that time, all of what we now consider mental illness, everything from depression to what lay people call insanity, what we generally call schizophrenia, were thought to be due to physical problems with the body. There was no clue that there was such a thing as mental illness. Freud and one of the other neurologists at the time, which was Dr. Charcot in Paris, began to figure out that some of their patients weren't suffering physical disease, although they often presented with physical manifestations, such as blindness or paralysis. These patients were actually suffering a disease of the mind. Freud made three fundamental, significant discoveries that we take for granted today. The first is that some physical problems could be caused by the mind, by problems with how the patient thought and felt. I've seen blindness, coma, paralysis, and many other conditions that were not due to physical diseases of the body. They were due to mental problems. The second great discovery of Freud was what he called the subconscious, what Dr. Jordan Peterson calls the fact that there's more than one person living in your head. Freud divided the mind into the conscious, what we think and know about, and the subconscious, hidden processes going on in our mind that we're not aware of or don't understand. Let me give some examples. Suppose I make a New Year's resolution that I'm going to go to the gym 3 times a week and exercise for an hour a day. And initially I do so, but by mid-February I've pretty much stopped going to the gym. Why don't I control myself. What's going on in my mind when I tell myself to do something and I don't do it? Who is the person in my mind that's resisting my conscious command? A second example of the subconscious is in dreaming. Sometimes I have dreams and I wake up and I understand exactly why I had that dream. But at other times I may wake up and remember a dream and have no idea what it was about, and it's puzzling to me. But the thing is, my mind created that dream. How can my mind create something that my mind doesn't understand? That's the subconscious at work. The third great discovery of Freud was talk therapy, what we now call psychotherapy, which is that some people with diseases of the mind would improve by talking alone. No medication, no surgery, no other physical treatments. All of these were revolutions in medicine. Now, next I want to talk about the different categories of mental illness and where neurosis fits in. Neurosis begins after puberty, usually in young adult life. It's characterized by persistent dysfunctional thoughts and emotions. An example is depression, where the person has persistent, unhappy, sad thoughts and emotions. These thoughts and emotions make the patient's life worse, not better. If the person's thoughts, emotions, and also behaviors make their life better, they are not mentally ill. People with depression have what psychiatrists call insight, which means that they're aware that they have a problem. People with depression and anxiety realize that there's something wrong with them, that the way they feel, act, and think is not right. And also, people with neurosis are not psychotic. They're in touch with reality. They don't, for example, hear voices when nobody's there, or have crazy thoughts, like one of my patients who had schizophrenia and told me that the FBI was putting evil thoughts in his head through his television. The next category of mental illness is what are called personality disorders. Unlike neuroses, personality disorders begin before puberty, often in very early life. As young as 6 months, the mother may notice that there's something wrong with the way her child behaves. Personality disorders are also characterized by dysfunctional thoughts and behaviors that make the patient's life worse, but they're more likely to make other people's lives worse as well. People with personality disorder characteristically lack insight. They do not realize there's anything wrong with the way they think, feel, or act, even if they're told that they have a problem. They lay all of their problems at the feet of other people, and a person with a personality disorder will feel that if only everybody else would change and act the way they're supposed to, my life would be just fine. There's nothing wrong with me. People with personality disorders are also in touch with reality. The third group of mental disorders are the psychoses, and these are the folks that lay people would call insane. The psychoses begin after puberty, usually in late teenage or early adult life. These people are out of touch with reality. They may have hallucinations, for example, hearing things that aren't real or seeing things that aren't real, and they have delusions, false beliefs, like the belief that the FBI were putting evil thoughts in the person's head. People with psychoses sometimes have insight and sometimes don't. It depends on how insane they are. As an example, I talked in a previous video about a person with schizophrenia that I saw for a disability exam and asked him about it, and he described the voices that he was hearing while he was in the office with me. However, he knew that those voices were not real and that they were caused by a disease that he had called schizophrenia. So he had a good deal of insight into his problem, despite the fact that you would consider him insane. However, some people with psychosis really believe their insane thoughts or visions or hallucinations and don't have insight. The fourth big category of psychological problems are what's called organic brain syndromes. And this is problems with behavior, thinking, or feeling that are caused by physical disease, not by mental processes. These can come on at any age. They're due to physical, not mental illness. The person may or may not be in touch with reality, and they may or may not have insight. Examples include Alzheimer's dementia, where the person is confused and has very poor memory. Another example would be alcohol withdrawal. I had one man who was withdrawing from alcohol who told me that he saw a little green dinosaur in the corner of his room. I had another young man who was withdrawing from alcohol and was lying on a stretcher in the emergency department and told me that he was terrified by the witches he saw on the ceiling of the emergency department. It's crucial for doctors to differentiate organic brain syndrome from all the other psychological conditions, because organic brain syndrome requires physical treatment, not psychotherapy. And psychiatrists are always worried about mistaking a person whose mental manifestations are due to physical disease and treating them as if they're mentally ill rather than physically ill. And this brings up an important point, and something I think is too often neglected today. Anyone who's being diagnosed with a serious mental illness deserves a complete physical exam and usually some tests of the blood and urine and possibly imaging of the brain, such as MRI or CT scan, to make sure that their psychological problems are not due to physical disease. Well, I'm going to stop at this point, and in my next video I'm going to be going into detail about neurosis and especially how to present your problems to have the best chance of being approved for disability. I hope this has been helpful, and as always, remember, if it happens, it's possible.